Hernias are protrusions of abdominal contents, usually the small intestine or omentum, through a weakness, defect, or opening in the abdominal wall. Inguinal hernias are the most common type, occurring when abdominal contents protrude into the inguinal region through a defect or weakness in the abdominal wall. There are two main types of inguinal hernias, indirect and direct. An indirect inguinal hernia occurs when abdominal contents herniate through both the internal and external inguinal rings, lateral to the inferior epigastric vessels. It results from a congenital patent processus vaginalis and is the most common type of hernia, especially in males and infants. A direct inguinal hernia occurs through the floor of Hasselbalch's triangle, medial to the inferior epigastric vessels, and result from mechanical breakdown in the transversalis fascia due to aging, making it more common in older men. Femoral hernias occur below the inguinal ligament through the femoral canal, below and lateral to the pubic tubercle. They are caused by increased intra-abdominal pressure or a weakened pelvic floor and are more common in females than males. Incisional hernias occur through the site of a previous surgical incision due to localized mechanical weakness of the abdominal wall. Risk factors include older age, smoking, obesity, immunosuppression, connective tissue disease, wound infection, poor closure, facial dehiscence, and larger open surgical procedures. These hernias are most common after midline abdominal incisions. Spigelian hernias occur just lateral to the lateral border of the rectus muscle due to a defect in the Spigelian aponeurosis, which is composed of the transversus abdominis. They are rare and usually occur in the 5th or 6th decades of life. Umbilical hernias occur at the center of the umbilical ring and are typically caused by herniation of omentum or peritoneal fat through the umbilical ring. Bowel may also herniate through this opening. Risk factors include obesity, abdominal distension, ascites, and pregnancy. Umbilical hernias are more common in females, but are more likely to present incarcerated in males. Epigastric hernias occur in the midline between the umbilicus and the xiphoid process. They are thought to be due to a congenitally weakened linea alba, with risk factors including extensive physical training, chronic coughing, obesity, smoking, chronic steroid use, diabetes, older age, and male sex. These hernias are rare, but more common in males. Epigastric, umbilical, and anterior incisional hernias are all classified as ventral hernias. The Hasselbalch triangle, important in distinguishing direct and indirect inguinal hernias, is bounded by the inguinal ligament inferiorly, the inferior epigastric artery laterally, and the rectus abdominis medially. Complications of hernias include incarceration, where the herniated tissue becomes trapped and cannot be reduced, and strangulation, where the blood supply to the herniated contents is compromised, leading to ischemia and necrosis, a surgical emergency. Because of these risks, surgical correction is indicated for most hernias. The definitive treatment is surgical repair, which may involve herniorrhaphy or hernioplasty.